Good afternoon, everyone. Our apologies for the delay. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide brief remarks, and then we will open the floor to questions.
Thank you, Tom. Good afternoon. Today, I am pleased to report that 6,218 Albertans have recovered from COVID-19, leaving 612 active cases in the province. Currently, 55 people are hospitalized with COVID-19, with 4 of these in ICUs. In the last 24 hours, out of 3,754 new tests, there were 22 new cases. I am pleased to say that there are no new deaths today, and in today's outbreak web posting, several outbreaks have now ended, including the Horizon Work Camp and Manoir du Lac. I want to acknowledge the work of local teams in stopping spread in these outbreaks, and in particular, want to note that using lessons learned from Curl Lake and with significant effort from the company, the Horizon Work Camp outbreak was kept to only 5 cases. With today's test results, we have now surpassed 250,000 COVID tests in Alberta. This is a remarkable achievement and a testament to the tireless efforts of our public health system, from our lab technicians and contact tracers to the public health nurses and those working at assessment centres. Strategic testing is essential to Alberta's relaunch. Over the past couple of weeks, our daily volume has ranged between 2,000 and 4,000 tests per day. We have the capacity to do more, and in preparation for Stage 2 of our relaunch, now is an opportune time to expand testing to get a full understanding of the presence of COVID-19 in our population. This is why, effective immediately, we are expanding testing to include anyone in Alberta, whether they have COVID-19 symptoms or not. This will help provide data to further understand the impacts of moving to Stage 2 of Alberta's relaunch strategy. Expanded testing will also help us understand where there might be undetected positive cases and therefore prevent further spread of the virus. If you were worried that you might have been exposed to COVID-19, even if you were feeling well and aren't showing symptoms, I encourage you to arrange for testing by completing the online assessment tool to book your appointment online. This can happen in Calgary immediately, and next week, this booking appointments online will be live across the province. No matter where you live, you can go online, effective today, to arrange for an appointment for testing. Please be patient as Alberta Health Service implements this province-wide asymptomatic testing. Everyone who wants a test will be able to access one, but priority will continue to be given to symptomatic individuals and close contacts of known COVID cases. As we continue through relaunch, we must remember the virus is still with us and we must still prevent the spread. As businesses and facilities continue to reopen, we must continue to prioritize the health of the most vulnerable of our community members. This includes Calgary and Brooks, where Albertans in these 2 cities have been patient as we took a measured, phased approach to the first stage of their relaunch. Because taking this extra time allowed us to monitor any spread from opening businesses and other Stage 1 activities in Calgary and Brooks, where baseline rates were higher when we began Stage 1. I would like to congratulate residents of these cities on the downward trend in their numbers, which has not been seen in most places around the world where relaunch has happened. I am pleased to say that thanks to these numbers, the final stage of Phase 1 will begin in these cities on Monday. This means day camps and summer schools may open with occupancy limits, and places of worship may resume in-person services greater than 15 people, with precautions to limit the potential spread of infection. Public health orders limit occupancy at places of worship to 1/3 of the building's capacity to a maximum of no more than 50 people, based on lessons learned from outbreaks in faith communities in Alberta and around the world. Faith leaders must take steps to prevent the risk of transmission among staff, volunteers, and members of the public who enter their space. Expanded guidance for places of worship is available on our BizConnect website. I also committed to posting guidance for organized outdoor sports and recreation applicable for Stage 1 across the province. I know many people are eager to get outside with their teammates and play their favorite sport. But organized sports events, games, and leagues present a high risk of transmission and are not yet permitted in Stage 1. Non-contact outdoor activities can proceed with measures in place to limit the spread of the risk of transmission. Examples of such activities are running in physically distanced groups, singles tennis, and badminton or skateboarding. Activities like soccer, football, or martial arts are not permitted in Stage 1 unless organizers can modify practicing the components of these activities to meet public health orders and physical distancing requirements, such as a focus on individual drills rather than on team play. If you were looking to plan outdoor sports or other physical activities in the next few weeks, please refer to the guidance posted online. We will soon be at the 3-month mark since our first case was identified. Albertans have done a tremendous job pulling together, supporting each other, and protecting each other by following public health orders. I know that we are all tired of COVID-19. We are tired of the impact the restrictions are having on our lives. And I wonder sometimes if asking Albertans to wash their hands one more time feels like nails on a chalkboard at this point. The trouble is that the virus has not disappeared. We are learning to live with it in a way that keeps the most vulnerable members of our community safe. And so it is important that we all continue to do our part by looking out for each other as we open activities back up. I am confident we can continue to work together to keep each other safe as we take additional steps along our relaunch path. Thank you, and I'll be happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Yes, thank you. The first question is from Janet French of CBC. Please go ahead.
Hi there. Thanks for taking my question. I just wanted to know a little bit about the single site rule for healthcare workers in long-term care. I understand that that limitation doesn't apply to people who work in other settings such as hospitals or fast food restaurants, which would be places that they might have interaction with the public or sort of large numbers of other people. Do you think that the existing order is broad enough to prevent workers from bringing pathogens into long-term care homes? And if so, why?
So when we instituted the single site rule, we looked at the evidence of where we were seeing introduction of COVID-19 into facilities. And one of the problems that we saw was the introduction of COVID-19 from one facility that had an outbreak into another facility where workers were moving back and forth. We haven't seen that same issue happening with workers who work outside in other sites, as you mentioned, such as acute care. We do encourage workers to, again, focus the time that they work as much as possible into that single long-term care site. But the decision was really based on the evidence and the epidemiology with respect to where we saw the risk of that transmission happening. And so if we did see additional concerns, certainly we continue to look at the evidence. We continue to monitor and determine whether or not we need to make additional adjustments or changes. But to date, the changes that have been made seem to have been successful in preventing that spread of outbreaks from one facility to the next.
Operator, can you put through the next question, please?
Yes, the next question is from James Keller, Globe and Mail. Please go ahead.
Hi there. Can you tell us, in terms of the public health emergency and the timing of it ending, can you tell us what advice you provided to the government about when or if that declaration should end? And are there any tools that you get from that declaration that you will not have at your disposal now once it's over?
So the declaration of public health emergency is the decision of government, and with respect to advice, I think it's looking at the ways that we implement the measures that we need to take to protect people from COVID. We don't need the declaration of a public health emergency to protect people from COVID. We do have tools, some tools with the declaration of the emergency and other tools that we can use outside of that declaration. So whether or not that public health emergency is maintained, we will still be able to, and we absolutely still will be able to respond to COVID-19 and protect Albertans. So the emergency really is a measure that allows a significant and rapid response, but it doesn't, if that measure is ended, we still are able to respond, and we do have other tools that we can use to do that. So with respect to the tools as a Chief Medical Officer of Health, for the things that I would need to do, those are not particularly linked to that declaration of a state of public health emergency.
Operator, can you put through the next question, please?
Thank you. Jason Herring, Calgary Herald.
Hi, Dr. Henshaw. Many businesses in Calgary, including restaurants and barber shops, obviously reopened this week. We're seeing a lot of demand and traffic to those businesses locally. We're also seeing a lot of Albertans getting out into public spaces like parks again. I'm wondering, from your view, how well are Albertans doing at staying safe and respecting public health restrictions while resuming these activities?
So we keep a close watch on the complaints that come in to Alberta Health Services with respect to the public health orders, and where concerns are being flagged where businesses or individuals aren't following those orders. And there has not been a significant increase in the number of orders that have come into that online portal over the last few weeks. So I'm sure, like anything else, there will be a small group of people who are perhaps really excited to be out and about, and perhaps, again, sometimes we're the victim of our own success, given that we have managed to lower the rate of virus in the province, that people may forget about the importance. But I think the majority of Albertans remember that we continue to be in a need to respond to the pandemic in a way that protects each other. And so again, the metrics that I have available to me really are that complaints, which doesn't seem to have increased. And again, my close monitoring of the numbers, which also are continuing to be quite stable and even trend downward slightly.
Operator, can you put through the next question, please?
Yes, thank you. Julia Wong, Global News.
Hi, Dr. Henshaw. A couple weeks ago, you said testing those with no known exposure is more likely to lead to false positives. You've also said that testing many asymptomatic people isn't necessary to move out of this pandemic, and also that testing broadly across the province is unlikely to yield a lot of good clinical information. Now that the province is expanding testing, what precautions are in place when it comes to false positives, and what new clinical information are you expecting to find by testing broadly? Or is this more about using the lab capacity that has been built?
So we have 4 key goals for using lab capacity. The first one is case identification. The second one is the identification of close contacts, contact tracing in a very rapid way. The third is rapid outbreak detection and management and control. And the fourth is population surveillance. And so with respect to expanding testing across the province, the anticipation would be that there wouldn't be a great deal of individual case identification beyond the focused efforts that we've been doing already. However, what it does do for us is that fourth goal of population surveillance. And what it does is it allows us to get a really good understanding of the presence of the virus in our communities in places where our current testing or our previous testing framework was focused on those who are at highest risk of exposure. And this current testing framework, again, is really focused on that population surveillance and our ability to take the next few weeks, do this expanded testing, and make sure that we have that full population picture as we anticipate our move into relaunch within the next few weeks. So with respect to false positives, it is potentially a concern that if you do test a large number of people who have a very low pre-test probability of having COVID, that you could get some false positives, but it's also true that the test is quite specific, and so the number overall of false positives would be anticipated as a proportion of the positive test results. We would still continue to investigate each positive result, given that we are needing to be cautious. However, again, the important thing to know is that this particular testing expansion will allow us to meet that fourth goal of population surveillance in a robust way, and will give us really good information as we prepare for stage 2 of relaunch.
Operator, can you put through the next caller, please?
Chris Epp, CTV.
Thank you, Dr. Hinshaw. Just curious that I know the contact tracing app doesn't even register someone unless they're exposed in close proximity to infection for 15 minutes or so. So given that, why are team sports still being not allowed to play, given that in many cases, such as football and hockey, you're wearing full equipment, you're wearing gloves, hockey may wear a full face shield, and your contact with other people is quite fleeting, like a matter of seconds, we're actually very close to each other?
So there's two components of close contact that are important when we're considering whether or not someone might have been exposed to the virus. One is the duration of time that someone's in contact, and the AB Trace Together app records cumulative exposure with that cutoff of 15 minutes, but it is cumulative exposure over a period of 24 hours. So if you have a minute or two of exposure to somebody that adds up to 15 minutes within 24 hours, you still would be considered a close contact. But the other component of determining whether or not someone is a close contact is the nature of the exposure. And so if someone were to be within 2 meters of someone else and cough or sneeze, or, for example, if they're exerting themselves, so if they're playing a sport and they're breathing really heavily and they come into close contact with somebody, you wouldn't necessarily need that full 15 minutes to have a risk of exposure. So the app really detects one component of exposure, but it's not possible for any kind of electronic app to detect the nature of an exposure. And it's that kind of high-risk exposure from sports and physical exertion that in this stage, in stage one, where we continue to be cautious with respect to limiting the close contact between people, that we are continuing to say that that close contact needs to be avoided at this time, again, because physical exertion does increase that risk of when people are breathing heavily, and we've seen instances of very large outbreaks globally from things such as fitness classes that are happening with large groups of people indoors who are working out a high-intensity workout. And so we can see that kind of activity does bring risk.
Operator, can you put through the next question, please?
Yes, Ravi Bujikanian, CBC.
Hi, Dr. Hinshaw. A couple of days ago in the legislature, Premier Kenney suggested that he is challenging public health experts to figure out how to create a wall of defense around seniors and the most vulnerable as we move to the next stages of Alberta's economic relaunch. I'm wondering, what does that mean for you?
So part of that wall of defense is the work that we've done with operators of congregate care sites to introduce many measures to protect seniors who live in those congregate care sites. And that includes things like ensuring that we have rapid response teams available in AHS who, at the first moment that anyone in those sites has any symptoms, that operators can call and get access to very quick testing. And then as soon as there is any kind of positive test result, that immediate outbreak measures are put in place. And one step before that, all the measures that are put in place to prevent the introduction of virus into those communities, so including daily screening of staff, restrictions on the ability of visitors, particularly visitors within facility. We have introduced outdoor visits for the last several weeks, given that there's reduced risk of transmission in outdoor settings, and also that limits the concerns about potential infection spread through surface contact. So I think the additional measures that I think we're considering are what types of advice we might be able to provide to seniors living in the community who aren't a part of these congregate settings, but providing them with additional information about how they can assess their own risk and the risk of different activities in their community, and how we can support other seniors outside of these congregate care settings and those who have chronic medical conditions, whatever age they may be, so that we can provide them with the best advice and supports to make sure that they have that information to be able to stay safe.
Operator, can you put through the next question, please?
Kevin Nimick, CTV.
Hi, Dr. Hinshaw. You announced expanded testing earlier for anyone who wants one. To be clear, does this mean residents can now have unlimited tests? Could I be tested every day or every second day if I wanted to be? We know this is a condition of the NHL setting up shop in Alberta, so that players could be tested often. So will regular people have the same access to tests as hockey players?
So there's no restriction on the frequency with which people can access testing. So that's not something that would limit people's access. Again, I think the recommendation would be that testing should never be used as a replacement for public health measures, because what we know is that a negative test is a point-in-time snapshot, and so it doesn't predict what may happen. If someone has been exposed and has a known exposure, they still need to be in isolation for 14 days, and a negative test result on day 1 or 2 or 3 does not change the need for that quarantine period. So absolutely, there is no difference between the access that Albertans have for testing in the next several weeks with access that the NHL may have. However, I want to reiterate that the access that was being planned for the NHL was through private pay options, and so there was never intended to be a differential public access to testing for any group.
All right, I think we've got time for 2 more questions. Operator, could you put through the next one, please?
Dylan Short, the Edmonton Journal.
Hi, Dr. Hinshaw. I was wondering if you've had any discussions around loosening restrictions on visitors to hospitals. I know that we're now doing some of the elective and non-emergency surgeries, and I've heard people are wondering when they may be able to visit people for non-COVID issues in hospital.
So I've had lots of those questions about visitors both to hospitals and visitors to continuing care, and I absolutely recognize that not being able to visit loved ones, whether they're in hospital or in continuing care facilities, is a significant challenge both for the individual who's either in hospital or in the facility and for their family members or close friends. So that is something that I've had some conversations with Alberta Health Services about. The AHS visitor policy is an organizational policy that is based on the continuing care restrictions that are in place under my orders, and so it's something that is being looked at. We do need to balance the risk of introduction of virus against the need for people to have support from their loved ones, particularly in hospital in what's a very difficult time. And of course, for residents of continuing care, having the ability to have social connection is an important part of their health. So we continue to have discussions and try to weigh out all of the interests, and particularly with residents of continuing care, it's not something that's an easy decision to make, because those people are the most vulnerable to severe outcomes. And so we do need to be very mindful of that when we're considering visitor restrictions.
Small point of clarification before we go to our final question. There are currently 616 active cases, and there were 24 new cases identified today. Operator, could you put through the final question, please?
Yes, the final question is from Michael King, Global TV. Please go ahead.
Hi there, Dr. Hinshaw. One quick update, if we can. Anything on the date for Stage 2? And then also just looking at hospitalizations, we see that those are actually up. I think there's 55 today, so that'd be up 10 in the last 4 days. Is that a concerning increase?
So the date of the Stage 2 is something that will be discussed next week, and so a final decision has not yet been made. I've said before that given the low new case numbers that we've been seeing, the really encouraging results from our Stage 1 relaunch, that we are considering whether or not we can advance the date of Stage 2, but again, a final decision won't be made until next week. With respect to the hospitalizations, there has been an increase in the last few days. Hospitalizations are a function not only of our total cases, but also of who it is that is exposed and is infected with the virus. So those who are older, who have medical conditions, are at higher risk of having more severe illness and needing hospital care. It's something that we're watching very closely, but at this point, we haven't seen an uptick in our total number of cases, and we'll continue to watch both total cases and hospitalizations closely, but at this point, I don't anticipate that what's happened in the last few days would change our discussions regarding relaunch. Again, we'll continue to watch that closely, and if the situation changes, that will always be factored into decisions going forward.
All right, thank you for joining us, everyone. We will provide another update on Monday afternoon. Have a safe weekend.